Okay, we're going to have a look at assessing quad and glute strength. Again, a really important one for quite a number of patient groups, particularly runners. I found really important to have that explosive power from the quads and the glutes when you're taking off. And if they're weak, then that's usually going to result in some compensation from the lower leg and foot muscles. So we're going to have a look at what's called the stand up, sit down test. A patient here is going to show us. So you have one leg that's going to be placed quite firmly on the ground. The other leg is off the ground, toes pointed, just being held off the ground. We've got here a great chair that goes up and down, so you can determine a height that the patient you think is going to be comfortable with, especially initially, but you can lower it. Obviously, the lower it is, the more challenging it is for the patient. So can you please show me a single leg stand up? There we go. All right. And now slowly sit back down for me. So what we're looking for is the strength to be able to stand up with that leg, and also balance when we get to the top, and balance sitting down. So I'll get you to have one more go at that for me. Okay. So coming back down. So what we want to see is if the patient needs to use their hands to get up, or whether they have to thrust themselves forward and use their momentum to stand up, or whether they can actually use the strength of their leg. And I'll get you to show me the other foot there for me. Okay, so we know that this leg is weaker and the balance is poorer. So in this case, we have to use a lot more momentum to throw ourselves forward, and there's a lot of difficulty standing still on that one leg. So working on the strength of that right leg and the balance is going to be a really important part of treatment. And you can actually use this as a treatment, and you can get patients to do it at home, do it on a chair. They can pile it up with books and go from a certain height that they're comfortable with, do 10 reps on each leg, and aim at getting lower and lower and lower and engaging those muscles better.